Welcome to another edition of Journey of Hope. Stories of people that have been impacted by some type of illness, traumatic injury, or some type of a crisis, and have gone on not only to be survivors, but thrivers. Our special guest today is William Hall, an individual that I met nearly 50 years ago, actually before I became a Christian. I was dating a girl, and she ended up moving down to California when I was attending Sacramento State, studying to be a dentist on a boxing scholarship. I thought that was a good combination. I was from a Roman Catholic background and hadn't really committed my life to Christ. And she stayed with these people in Sonoma before she went to school at Pacific Union College. The pastor at that time was William Hall. And it's so good to have you here, William. I'll call you Bill.
That's right.
And it doesn't matter whether you've got 40 years in the ministry and whether you've been a spiritual leader. It's still a sobering experience when you get those words, you have cancer. So before we talk about your cancer and your experience, let's talk a little bit about your background, where you came from, and your call to the ministry, and some of the things that you've been involved in.
Well, it's good to be here, Lynn. Good to see you again. I was born at a very early age in northern Texas during the Dust Bowl days. And as soon as I was able to travel and Mother was able to travel, the family headed west. I was fifth of a family that finally was 6 children. And of course, the pillow fights were great with 6 kids. But we traveled and ended up at Buena Park. In fact, my mother used to say that I was in 6 states before I was in 7 states before I was 6 months old. And
is that because you're moving through the states? Or?
Through the states,
okay.
Traveling. Because we went by grandmother's place up in Grants Pass, Oregon, and ended up in 1933 down in Buena Park.
Okay.
Now, my father worked for Knott's and hauled all kinds of things. My father had had a truck since he was 16, so he always was hauling things for people. And he hauled things for Knott's Berry Farm and helped them. And the Knott's had a roadside stand, where as you went down...
So when you say Knott's, you're talking about Knott's
Walter
in Knott's Berry Farm.
Knott's Berry Farm.
Okay.
Yeah, Walter Knott's, who owned Knott's Berry Farm and developed the boysenberry variety. They had a roadside stand, and so as people went by, they'd stop and buy berries, and then Mrs. Knott's would make her berry pies. So that was always a favorite, and Sunday was the time when everyone went out to see what the Knott's had. In fact, it became kind of an interesting contest. He would bring something different. I remember the first time he hung an ox yoke on the side of the stand. And then he began to get old types of equipment, farm equipment. And then finally got a covered wagon he set out there. So every week he had to find something new because he knew every Sunday everyone was going to come out there to see what he got. And then he started building his, I guess you'd call it amusement park and so forth. And my mother was one of the...
So you were there when they were really just beginning to develop this.
Just beginning.
Okay.
And my mother was one of the first waitresses of his first little 6-table restaurant
really?
He had there. So they knew the family. And one day, I was already in college at Pacific Union College, studying and trying to work my way through college, when Mother met Mr. Knott downtown, and she told me about their visit. And he asked where we were, and she told him about what all the kids were doing, and mentioned that I was at the college studying to be a minister and working my way through. Lo and behold, it wasn't too long after that, I received a check in the mail of $300 from Mr. Walter Knott.
Really?
And of course, that covered a whole quarter of tuition back in those days.
That was a lot of money in those days.
So that was a little bit of our history there. Then, of course, in 1941, the family moved up to Shafter, near Bakersfield, west of Bakersfield, where we were in the farming. And of course, when the war broke out there in December of 41, all the men went to war. They were going to go over there and get that job done in 6 months and be back home.
Yeah.
Thus, when the next summer came, us kids had all kinds of jobs on the farm. So we picked potatoes, we cut grapes for raisins, we picked cotton, we bucked hay, we did all those things. And so I grew up in that kind of an atmosphere. It was great.
A good work ethic.
Yeah, great. And then in 1951, I graduated from Armona Academy. I had worked part of that summer for Mr. Gilkey. We were hauling his, harvesting his barley and putting it in government bins.
Was this at the academy then?
Near the academy.
Okay.
And the government bins, they had an inspector there. Every load we brought in, the inspector was there to watch us as we put it away in the bin. And I got acquainted with a young fellow, and we visited every time I came in with a load. And he said, you know, Bill, we've got an opening in the agriculture department. Why don't you apply for it? So I filled out the application, went in for 2 different interviews. And in the last week of July of that summer, I received 2 letters in the mail. One of them from Pacific Union College that I had been accepted at PUC. The other that I had a job with the Agricultural Department of the state of California, and I would be assigned to Kings County, which was where we were living. Wow, what a decision for an 18-year-old. Now, I enjoyed giving Bible studies at that time. I enjoyed studying. I was wanting to be a minister, and so I wrestled with that for a long time.
So you kind of had this in the background,
kind
of a call to the ministry.
And I decided, did I want to deal with people or did I want to deal with bugs, which would be the agriculture department. So, but I finally decided, no, I wanted to be a minister. So I went away to PUC, and that was an interesting part of my life. The Lord blessed and amazing miracles to get me through.
So you graduated in what year then?
Now, 57, because I went 2 years into the Army in the Korean crisis, interrupted and then I graduated.
So that probably helped you out a little bit when you went back to school then?
Yes.
Okay.
Oh, GI Bill was a wonderful
big
blessing
for you. Great. So where did you begin your ministry then?
My first church was at Lake Tahoe, South Lake Tahoe.
Okay.
And then to Fresno, then up to Modesto, then into the MB Department, Northern California, in youth ministry. And then to Lodi Academy to teach Bible, and to Rio Linda Academy as Bible teacher and church pastor.
So you were pastoring and then went into education and then came back into pastoring again?
And that's when I ended up, after Rio Linda, went to Sonoma, and that's where I met you, there in Sonoma. And then from Sonoma to Lodi, and then from there down to Faith for Today. I spent 10 years at Faith for Today. While I was at Faith for Today...
I need to interrupt you because
that's right.
When I remember when I was going to Sacramento State, and I was a Roman Catholic, and I went down to date this girl that not everybody was really excited about my dating this girl that was really had an Adventist background and planning on going to Pacific Union College. In fact, when I first went down, I ended up sleeping in the vineyards. I mean, they didn't want anything to do with me, and I would meet her after she got out of church and spent the weekend with her, and then I would go back to Sacramento State. But I had a turning point in my experience, and it was because of the influence of those people in your church at that time that I really ended up becoming a Christian.
That's great. That means a lot.
It was your influence over those people at that point.
Well, the Lord bless, and I'm thankful for that.
So anyway, you continue on with your...
Well, anyway, when I spent time at Faith for Today, I first went there as field service director, which was to promote the television program with the churches and camp meetings and workers' meetings. And then in a budgetary move, they asked me to take up station relations, which meant I visited television stations, and so I would set up...
Around the country, you mean?
Around the country.
Okay.
In fact, from 1978 to 1982, I visited every known television station in the United States and Canada. Now, I did that because we displayed at all of their conventions, and I wanted to know the program director who made the decision as to what program they had on their television station.
So you're talking about all across the United States?
All across the United States and
Canada too?
I visited every one of them.
Every one of them.
And I did it while I was traveling to churches. So usually I would set up every month. I had a 3-weekend and 2-week trip. And I would be in the churches on the weekend and then visit stations during the week, church on the weekend, visit station of the week, and so forth, and then back home. And so during the summer, though, I went to camp meeting after camp meeting after camp meeting.
Again, in behalf of Faith for Today.
Yes.
Okay.
The first summer, I was flying all over the place, camp meeting to camp meeting. And my wife was home by herself because she teaches music, and the school year was mainly active, and here she was sitting by herself, and I was flying around the country. So when we got back home that fall, I told the treasurer, I said, you know, isn't there some way I can do differently? I think, and I penciled out that it would be as cheap or cheaper for me to drive, and she could go with me. And so we did. We drove all over the country, all across Canada, and all over the place. For several
people
years.
everywhere.
Oh yeah, it was great. Now my wife likes to read, so while we were traveling, she would read books and watch the scenery, and then read and watch the scenery, and I would listen. And in the process, we averaged 9 books per summer.
Oh, did you really?
So that was really great. The Lord blessed.
And you had, how was your health over the years?
Oh, it was great.
No problem whatsoever.
No problem at all. Great health. Basically strong as an ox, I thought, and didn't stop me from doing anything. So, but it's interesting, during Faith for Today's time, they had sent a donation into the National Religious Broadcasters Organization, and the treasurer there said, "Oh, this is enough to make the member." So made Faithful Today a member of the National Religious Broadcasters Organization. Well, when some of the staff saw that, said, "Oh, wait a minute, they can't be members, they're Adventists," you know? And because there was that negative attitude against Adventism, we were a cult and so forth.
Right.
But here I was a member. I was voted on their TV committee in '69 and served for about 25 years on their television
really?
committee. Now here I was an Adventist that wasn't supposed to have membership, and yet I was on their committee planning all kinds of their workshops and meetings and so forth. So I found that very interesting and developed a lot of wonderful friends.
Well, I mean, it's interacting and relating with people that you develop friendships,
Yes.
and they begin to see a different perspective of what a Seventh-day Adventist really is.
Yeah.
So now everything's going fine. You got 35, 40 years in the ministry. You're about ready to retire.
Yeah,
and
that
tell
was
us what happened. Yeah,
in
because some things begin to
okay,
change.
Right. In 1996, I went in for my annual physical, and the doctor said, "How's your PSA?" I said, "What's PSA?" And he explained it to me, and he said, "Well, we better take a blood test." So they took the blood test, and it came back 6.4. Now, if I knew what I know now, I would have become aggressive in some kind of treatment. But he
So
said...
at that point, you're in your, how old are you?
Well, let's see, I was about 63, I think, somewhere in there. In my 60s.
6.4. And tell the audience here and tell me what a PSA is.
Okay, the PSA is the measurement of the protein that's in your prostate. And so that's the way they use to kind of measure
it's an
the presence
indicator.
of
It's a
an
measurement.
indicator of cancer or any problem. So he put me on antibiotics, thinks, well, maybe we've got an infection there. It came down to 5.3,
Okay.
and it hung around 5.3 between there and 5.7 for 8 years. Now, every time I'd ask the doctor, I said, "Is there anything to worry about this PSA at that?" "No," I said, "it only if it jumps, we'll worry about it." Well, as I said, if I knew then what I know now, I would have aggressively sought some kind of biopsy and treatment and so forth. But anyway, in the process, of course, I had ED and all those other problems that go along with it, and they tried all kinds of medications. And then I retired, finished developing a television station there in Boise, owned and operated that. And then in 2000, we moved down to Hemet, and I developed a FM radio station in Temecula. And so that's kind of the background of my activity. And then in '05, it was '04, December of '04, my PSA came in at 6.8, I think it was.
So it had jumped up.
It had jumped up.
Okay.
And so the doctor sent me over to the gynecologist.
Oh, how about not a gynecologist? You want to go to urologist.
Urologist,
probably.
okay.
Yeah, if you went to a gynecologist,
Right.
you'd have a little problem. Yeah. Okay.
Went to the urologist, and he took another test. It was 7.1. So then they did that famous shotgun
So they
biopsy.
they decided to take some biopsies. How
And
many
then,
did you have? You remember?
I think at that time I had 12.
12, okay.
Now, after reading Bob Martini's book, I should have had at least 16, I think.
Well, but you got the 12.
And it came back positive, so the doctor called me and said, you need to come in for a visit. Well, you're suspicious a little bit. You wonder what he's going to say. And when you sit down in the chair and he
So
looks
you
at
get a phone call from the doctor and
Yeah.
said, hey, we got the results of your biopsy. You probably want to come in. Did he ask you to come by yourself? Or was your wife?
No, she didn't go
She
with me,
didn't
as
go
I
with you.
remember. no.
Okay, so
And I sat down in the chair and said, well, what's up? And he looked at me and said, you've got cancer. And
you have cancer. Just like that.
there's no way to measure the emotions. It's funny, every emotion in your life goes through because you don't know the certainty, you're scared to death, you don't
Cancer.
know what to plan. Cancer, yeah.
I mean, the big C.
That's a scary...
Even though prostate cancer may be a little c,
Yeah.
all you hear is cancer.
That's right.
And people die from cancer.
Yeah.
Yeah, I've got the big C. Well, cancer is a diagnosis, and even prostate cancer is a diagnosis, not a death sentence.
Yeah.
But when you hear the word cancer,
You think
you're right, all kinds of things go through your life, and your whole life passes before you.
You think it's a death
sentence.
sentence.
It's a death sentence. I got cancer. It's terminal. Cancer's terminal.
Yeah.
Failing to realize we're all terminal.
In fact, I just recently got an advertisement about a new book by Suzanne Summers.
Okay.
And it's talking about curing cancer. And it talks about all the problems. It said, you've had cancer, probably the 3 scariest words you'll ever hear from your doctor. And then she talks about various treatment modems that they're going through. So anyway, it was after that I began to do a lot of research as to
So you went home and told your wife.
Well, yeah.
And tell me what.
And then I started
How did she respond?
Well, she was uncertain. What does that mean? You know, and it was a little scary for the wife to hear.
What does it mean? But you know what it meant. You have cancer.
Yeah.
Yeah. Okay.
And so I got busy reading books and looking on the internet. I knew that Loma Linda had treatment. I'd read an article in one of our magazines about them treating eye cancer. I think one of their first things was treating eye cancer with a proton treatment. Mm-hmm. But I knew very little about it. And my HMO kept saying I should do surgery, or I should do seed implant, or I should do radiation and so forth, because they didn't want to pay for the costs of Loma Linda proton treatment, even though I began to see that may be the way to go. Now, it's interesting that in the fall of '05, I had a friend said, you know, the patients at the proton treatment meet every Wednesday night. Go see if you can take that meeting in.
That's the educational support group,
Support group
for cancer patients, and many of them are prostate cancer patients.
I visited that meeting 2 consecutive Wednesday nights. And I've been to motivational meetings. I've been to sales meetings where everybody's all hyped up and excited. There is nothing like it when you go to that meeting to hear the report of the alumni who come, and to hear the people who are patients talk about it. It just excites you.
It's a group of cancer patients, but you'd never know they were cancer patients by their behavior. They're laughing and having a great time and talking openly about the experiences that they're having.
Yes, yeah.
So how did this impact you?
Well, it sold me on the idea. I said, that's
Did you go
where
by
I wanna
yourself,
go.
or was your wife with you?
No, I went by myself.
You went by yourself.
She's usually busy teaching piano lessons, even in the evening. And so I decided that's what I wanted to go. Well, dealing with my HMO and the insurance was a problem. So I finally had to drop my HMO, apply directly to Medicare, and to get the treatment worked out.
And Medicare covers proton
yeah.
treatment, okay.
So then I started in September of '05 and finished in November of '05. Had 44 treatments, and they were pleasant treatments. It was fun. It took about an hour.
It was fun. I hear this again, and people talk about
the doctors.
They use
nurses.
different experiences about their experience here, and I mean, I've heard people say, you know, it was a radiation vacation.
Yes.
Or, you know, they talk about it as the best time of their life, you know, a transforming experience. So did you, again, come by yourself for the treatments?
Yes, I came each day. I kept on working. Worked every day.
Continue working.
And I just
even
drove
though you
in.
had cancer and you were being treated for cancer.
Got my treatment, rode back home, and went back to work.
Okay.
And, excuse me. And so it was really a kind of a pleasant experience for me. The only side effect I had was Rose hips.
Rose hips.
They traded treatments. One day they would do it on the right side, one day the left. So my hips got a little red and rosy.
Now, that probably didn't happen until towards the end of the treatment.
Toward the end of it.
And you're talking about some little rose spots.
No spots on my hip.
And that's why some of the fellows said, you know, I didn't experience anything before I came. I didn't have any side effects before I came. I didn't have anything when I'm here, and I'm leaving now, and I don't know anything except I got these little rose spots. There must be something going on. So you finished the treatment. This was 5 years ago now.
Yes.
5 years ago.
It's interesting. My PSA dropped from 7.1 and a cancer aggressiveness of 6.
That's a 3 plus 3, which is a normal, that's a normal, what we say sometimes the garden variety.
Right, yeah.
A Gleason score, that's a rating.
The Gleason score.
Okay.
And it dropped down now to where I have no evidence of cancer, and my PSA is 0.4.
0.4. Well, congratulations.
And that's great.
That is wonderful news.
So
well, tell me, you're getting this cancer. What difference is it making? What difference did it make to you I mean, was this just a little bump in the road, or was it kind of a serious thing, and others were concerned about it? I mean, the important thing is here you are, a spiritual leader, and even being a spiritual leader, you know, the rain falls on the just and the unjust, and calamities and illness and traumatic injuries still come upon people, even though they're a spiritual leader. I mean, did you wonder where God was in all
Well, yeah,
this?
you always ask that question, why God? You know, why me? And then you think, well, you know, I'm not that any different, you know, why not me? You know,
That's an important question.
Yeah.
Why not me?
that I'm just like everyone else, and but the miracle that takes place after that is always the excitement part of it. God changes things, and He answers our needs. Now, I wish I had known about Bob Martini's book before that.
You can beat prostate cancer.
Oh yeah, because he,
Bob was
of
here
course,
about 10 years ago.
and was cured and has developed a group of fellows, and it's wonderful. And has written this book.
Yeah, when Bob left 10 years ago, there were about 9 people, and they decided to call themselves the Brotherhood of the Balloon, or the Bob, and kind of an acronym there. And when Bob left, he said, how in the world am I going to stay in contact with 9 people? Some of us in administration heard about it and thought, this is a wonderful opportunity for patients to stay in contact with one another and with the institution. And that little group that Bob started is over 4,400 now in all 50 states. And I think there's 27 countries. It's the largest international support group for prostate cancer and cancer awareness in the world.
And his book is really an excellent book. I wish I'd had that earlier. You know.
Well,
Then
Bob
it
said he
would
wrote
clear
the
a lot
book
of questions.
and
You know?
wishes that would have been available for him, because, and I find that many of the patients come in, they read the book and say, you know, he's answering the very questions that I've gone through here. Yeah. So now, tell me what difference having cancer has made to you. There's 2 questions I leave with many of the people that come in here once we get acquainted. I said, one is, now that you have cancer, what difference is it going to make to you? That's the first question. The second question I want them to think about, and I begin to share this with them after they've been here for a little while, now that you have cancer, and now that you've been treated, and now that you're leaving, what difference are you going to make?
Well, the first question, it makes you measure life differently. Suddenly you realize that you are not infallible, that you can be struck down, you can face a dangerous disease.
All of a sudden you see mortality for the first time, face to face.
Suddenly you begin to think, you know, I want to live till I'm 100. Is that going to happen? And you begin to question, how long is how long? You know? And then you become enthused to want to share it with others. So I bought a bunch of those books. I've given them out to a lot of people.
Yeah, and for the listening audience, you know, You Can Beat Prostate Cancer is available on Amazon.com, and you can locate the book there. It's available in other places, but that's a good place to go.
So if anyone out there is facing prostate cancer, or your doctor has told you you've got cancer and it's prostate cancer or any other kind of cancer, get that book and read it, and then come to Loma Linda and get treated, where things work out great. So I've been appreciative of that.
So this was 5 years ago that you were diagnosed, and you've been treated, and now your PSA is down where it's negligible now. So you're doing fine as far as being treated for prostate cancer. What difference has it made to you?
Well, again, the measurement of life. You want to help others, and you look at life a little differently, and you try to live every minute, every year, and enjoy every bit of it.
Have you been back to the medical center or to the support group?
Oh yes,
meetings?
I've been back to the support group several times, and it's always exciting every time.
Well, they love to have people come back that were treated, whether it was 1 year ago or 10 or 15 years ago, and say, hey, here's a guy that was treated, and look at him, and look at how he's doing. And you know, some of the people they begin treatment, and even while they're here, it's too good to be true. You know, they talk to a number of different people, and I had some people say, are the people I talk to, are they part of your marketing staff? You know, I said, no, they're just very happy patients that were here and are willing to share their experience.
Yeah, it's a blessing. And you know, I thank the Lord for one thing, and then I thank the doctors and nurses and technicians. I want to thank Dr. Jim Slater for the idea and getting it started and promoting it, and for the church who adopted it, and the medical institution that incorporated it as a part of their treatment program. It's great. It's a blessing. Now I understand that there are several centers like this all around the world because of this good type of treatment.
Yeah, it all began here in Loma, Lynn 20 years ago. We're coming up on our 20th anniversary. We've treated over 14,000 patients.
Wow.
Probably 70%, 68 to 70% of those are prostate. When we started that first year or so, we were treating 1 or 2 types of cancer. But now today we're treating 44 different types of cancer.
Right?
And they're continuing doing all kinds of research and on the cutting edge. We got a clinical trial with breast cancer.
That's what I understand.
We have a clinical trial. You may not have heard about it. We have a clinical trial that for prostate cancer. Normally the patients now coming in, when you were here, was 44 treatments. Now they're getting 45. But several months ago we began a clinical trial with 20. Not 20 treatments, but 20 days of treatment, where they come in on one side on the first day of the treatment, and then they come on the second on the other side, so that they get really 40 treatments in a period of 20 days. And we've backed off. We're kind of analyzing the data and see how that's going.
So they're doing two treatments per day.
They're doing 2, yeah,
which
at
gives
the
them
same
40
time.
Treatments in 20 days.
Correct, and it looks
well.
Very,
You're shortening their
very
vacation.
Yeah, and we've got a clinical trial for breast cancer where women with a certain type of cancer, an early stage with a lumpectomy, is followed up with just 10 treatments instead of the normal 35 or 40 radiation treatments. So it's very, very fascinating. Well, what are you doing now that you're retired, but I know that you're still going. You're still doing a lot of different things.
I'm still climbing ladders and putting up satellite systems so people can get the Christian programming.
You're doing satellite systems so that people can watch LLBN.
That's right, and watch this program.
Yeah, that's right, and I appreciate that. And you've been making a number of different contacts. Well, I want to talk to our listening audience here. You know, Bill, again, is an example of one of the people out of the thousands of people that have been in Loma Linda that have been treated for cancer. And he shared his experience and what a sobering experience it is. Even though you're a spiritual person and even though you're a minister of the gospel for over 40 years, he still received those sobering words, "You have cancer." But Bill worked his way through it with his family and other people praying with him and praying for him. And I want to tell you out there in the audience that I know there's some people that even this week have found some very sobering news. And I want to share with you that God's got a plan for your life. If you'll give him an opportunity, if you'll listen and seek counsel and pray, God will take you all the way. Until next week, I'm Lynn Martell with Journey of Hope. I want to wish you God's richest blessings. Until next week, goodbye.